Sample collection. Pre-analytical procedures are an important part of any diagnostic test and are especially critical in platelet function testing. We'll now review the appropriate sample collection procedure for this assay. The appropriate procedure for sample collection requires a 21-gauge needle or larger, or a butterfly cannula can be used as long as a 21-gauge needle or larger is used. Also needed is a blue top 2 milliliter Greiner vacuette partial fill tube with 3.2% sodium citrate, or a green top 2 or 3 milliliter Greiner vacuette partial fill tube with lithium heparin. The green top tube is used only with the VerifyNow 2B3A assay and must be used when the 2B3A inhibitor used is eptifibatide, also known as integralin. A discard tube, preferably a second sodium citrate tube, will also be required. It's important that the specified tube be used because the VerifyNow system needs to draw the sample from the tube by vacuum. For this to work, there needs to be enough volume of air, called headspace, within the tube. This is essential for the assay to perform correctly. Please refer to the user's manual, or talk to your laboratory supply representative for ordering information on the Greiner tubes. Also note that with the VerifyNow 2B3A assay, 2 samples must be collected. The first is to be drawn before administration of the GP2B3A inhibitor, while the second is to be drawn 10 minutes after drug administration. Both samples should be collected following the same sample collection procedure we will now cover. Sample collection can come from either direct venipuncture or from an indwelling catheter. We'll first review the procedure for collecting a sample via direct venipuncture. Choosing an appropriate sample collection area according to your institution's phlebotomy practices is very important, but the order in which the samples are collected is equally important to the function of the VerifyNow system. A discard tube must first be collected to avoid any activation of platelets from tissue factors released during the initial needle insertion. It's vital that this tube not contain any platelet-inhibiting substance, such as the purple top tubes with EDTA. The discard tube can be another blue top tube containing 3.2% sodium citrate, and can also be a plain blood culture tube. There should be a minimum of 2 milliliters collected for the discard tube. Next, the VerifyNow assay sample should be collected using the Greiner vacuette tube. For this demonstration, we're going to be collecting a sample for the VerifyNow P2Y12 assay, so we'll use the blue top 2 milliliter partial fill vacuette containing 3.2% sodium citrate. Before we collect the sample, we must make sure that we collect the appropriate amount of blood. It's important to know that these tubes are self-filling. They're designed to draw 2 milliliters of blood and will not overfill. Notice on the label there is a black mark. This is the 2 milliliter level in the tube. It's important that the tube be filled to this line and is not underfilled. The 3 milliliter green top tube utilizes the same mechanics. However, it fills to 3 milliliter. Notice how the sample is drawn into the tube and stops when 2 milliliters have been obtained. Again, we must verify that we've acquired the needed quantity of blood for the assay. Immediately after we've determined an adequate sample has been collected, we invert the tube 5 times to ensure adequate mixing and check the sample for evidence of clotting. Any sample that shows the presence of clotting should not be used, and another sample should be collected. After determining the sample is valid, we should write the time and date the sample was collected and the patient ID on the tube. After this sample is collected, it's now okay to collect additional tubes if a CBC or other tests are to be run. For the indwelling catheter sample collection, we will again require a blue top 2 milliliter Greiner vacuette partial fill tube containing 3.2% sodium citrate, or a green top 2 or 3 milliliter Greiner vacuette partial fill tube containing lithium heparin if running a 2B3A assay. Before the test sample is collected, 5 milliliters of blood must be collected and discarded to clear the line. Also, we must ensure that the catheter is free of clots to enable a clean sample collection. Next, draw at least 5 milliliters of blood using a plain syringe and immediately transfer the sample to the sample tube by connecting a 21-gauge needle or larger to the syringe and piercing the tube septum, allowing the vacuum to pull the blood into the collection tube. Verify that the tube is filled to the black mark on the tube label and is neither over nor underfilled, as this may cause errors when running the assay. Once we've determined an adequate sample has been collected, we invert the tube 5 times to ensure adequate mixing and check the sample for evidence of clotting. Any sample that shows the presence of clotting should not be used, and another sample should be drawn. After determining the sample is valid, we should write the time and date the sample was collected and the patient ID on the tube. Again, samples that are being collected for other tests, such as CBC in a purple top tube containing EDTA, must be collected after the VerifyNow sample, due to the inhibition of platelet function that is caused by these tubes. All sample tubes for the VerifyNow assays are to be stored at room temperature and should not be placed on a shaker plate or tube rocker. Also, once a sample is drawn, it must be used within 4 hours for the VerifyNow aspirin and P2Y12 assays, and within 15 minutes for the VerifyNow 2B3A assay. It's important that sample tubes collected for the VerifyNow assay not be shaken or excessively disturbed, as this can cause activation of the platelets or bubbles in the sample, both of which can cause an error when running the assay. For more complete information on sample collection and handling, please refer to the Sample Collection section of the User's Manual, Assay Package Inserts, and Sample Collection Procedure Cards that were provided with the VerifyNow instrument.